Hello Jill, so we are doing a Skype session today, and Jill, just to recap, you are 36 years old. You basically live off white bread, one kind of brand, I think you said, two types of crisps, prawn crackers, golden delicious apples only, yogurt, and then sweets, and that's, I think, mostly it. To ask you a question, Jill, if you're to see a different kind of apple, what you say, well, you know, it looks like an apple, but it's not golden delicious, and I can't eat it. Is that correct? It's like part of your brain would say,
Yeah.
That's not safe. Golden delicious is safe.
Yeah.
If you're to try and eat it, would you gag or retch, or would you just not even pass that stage and you just couldn't put it near
Most
you?
of the time, I wouldn't even get it to my mouth, but if I got it in my mouth, my throat would just close and there'd be no chance of, even if I managed to chew, I'd be able to swallow it.
Right. That's the system clamming up. Okay. And have you seen people before for this? Any other kind of therapists?
Yep, I've seen dietitians, every doctor. I've been hypnotised by Bob Burns, which helped
Okay.
to a point expand some fruits and that, but I couldn't move on or do bigger things like meat or anything.
Okay. And do you happen to know when this started for you by any chance?
It started when I was 8 months old. It's basically as soon as I was coming off baby food and my mum tried weaning me onto normal food, that's been it ever since.
Okay, fine. So, you've got some foods ready for the end of the session. If I were to ask you to eat them now, you'd probably say to me, as you said to me earlier with apple, you know, your throat would close up, they just wouldn't get through anyway. Yeah. Okay, great. So if at the end of the session you are eating them, you'll know for a fact something's changed. Yeah?
Yeah.
Okay, great. So thank you. Let's see how we get on. Thank you all again. Ready for the count. Just 1 and 2 and 3. Just eyes opening, back with me. Hi Jill, how are you?
Good.
Great. What was that like as an experience for you? So,
It's so calming. It's
calming, isn't it? Yeah.
yeah.
Is it compared to your other hypnosis? Was it similar, different, lighter, deeper?
Similar.
Similar. So your body likes that route. It likes the hypnosis route for change. Great. So now, of course, the reason I ask people to bring in food is if you think about it, I'm asking you feel normal around food, or what does normal feel like? Kind of feels normal, yeah? Because sometimes people open their eyes, they say to me, great. Okay, so what have you brought with you?
I've got ham, a selection of cheeses, just mini ones,
Okay.
a Philadelphia spread, and Muller rice with jam.
Sure. So of those foods, which is the easiest one for you to eat? Start with first.
Probably the orange.
Sure. So do you want to go with that? Just notice you feel very differently about it.
It's really bad to say. I don't even know how to peel them properly.
Is anyone else with you? Or I guess you're on your own now, yeah?
Yeah.
Can you show it to me on the screen? So you can just chop it in half and then quarters, and then sort of kind of like they do in rugby teams, to just kind of suck it in wedges.
Yep. 1 second. I'll
Sure.
let you get.
Did you see Bob for one session, was it?
I went to about, I think it was about 3 with him.
3, okay.
With a wedge.
What's that like?
It's really nice and juicy.
Isn't it? Isn't it just, yeah. See, there's some nice surprises waiting for you. Just there. But now you've got the blocks out of the way. And explore them. Like a scientist. So, we know oranges are a winner. For sure. Definitely eat that again. Great. So rather unusually, I'm asking you to, to try this new food. Can you stop eating it and try and just try something else? Yeah. Yeah. Oh yeah, which is actually better to eat it that way rather than juice, you know, because you get the fiber with the pulp and stuff. So it's better for you.
That's the bit the ones that normally would freak me out the most, the white stuff.
Sure.
Right, cheese.
Cheese, okay.
It's a mini Edam.
Mini Edam, okay. It's a bit bland as cheeses go. You know, I prefer slightly tastier cheeses. Oh, pussycat. Where food's involved, pets.
Nope.
Didn't like that one. Cheese is a bit like Marmite, you know? People like it or they hate it. So, and it's also that cheese. It's, you know, it's a different texture, everything. So I recommend you try, say, melted cheese on a pizza, which tastes very different. Cheese on toast, for instance. And it's like me, I don't like raw onions, but I like fried onions. Caramelized onions on a pizza. So again, variety is your friend with that. At the moment, your system, your taste buds are saying, not quite ready for cheese in that way, but I'm open to trying it on a pizza.
Yeah.
Or cheese on toast. Or a jacket potato or something. Okay. What else do you have there? Yeah.
Ham.
Okay, is it ham in a little bun or something, or just on it?
I bought a roll here.
Yeah, if you could put it in there, I think it's a bit nicer. Yeah. Wait. I heard a cat begging. It's a bit nicer in the bacon form. Yeah. Cold cuts are not very successful, to be honest with you. So people don't really like the bacon and bacon lettuce tomato sandwich, but they like it grilled. So again, cooking does change the texture of it. Do you have a chef in your pub that can whip something nice up for you?
I have two professional chefs that are regulars that promise that they're going to cook me whatever I want.
Oh, great. Great. Yeah, because that's a lot easier than just a bit of cold ham, you know? Get something nice there. Even like a pork chop, you know? Yeah. I don't really eat cold ham. Well, one, it's not very good for you, I think it's processed, but I don't like it cold. It's slightly slimy, but I love pork chops, you know? Ribs. So it's about finding it that new way, yeah? Very good, but you're trying it, and even when you try something you don't like it, you say, well, I tried it, look, I don't really like it, you moved on. 2 seconds of discomfort is not worth the left path. You think, I can handle that. Yeah, cool. Anything else you got there? A
Miller rice with jam, because I've not been able to do every jam on.
Sure. So when you open that, just stir them well together, and I have to say, I'm seeing a trend with smokers. Smoking also does something to the taste buds, and it seems sweet foods stand out. And the other foods, I think if you stop smoking, then it also allows your taste buds to wake up a little bit. But sweet foods tend to be a winner.
Yeah.
And this is sweet. Yeah.
That's nice.
It's nice, yeah. I thought it would be nice, yeah. You know that fruit and sweet stuff is definitely a winner for you. You could also do something like pork chop with a bit of apple sauce, which is really nice. It's like a kind of apple jam. And there are ways to make things, you know, that there are sweet salads with sweet dressings, just to start with. You know, we don't want to give you a sugar, but, you know, well, with honey, for instance, you know, which is a bit better for you. But you can eat as many foods today, Jill, as convince you change has taken place today. You know, one thing, you're having a really lucky day, but 4, 5, 6 things, so as many as you want, you know, I'm here. So are you convinced yet? Do you need to get some other foods out?
No, that's amazing. even when it went in my mouth and I didn't like the taste, the
Yeah.
throat didn't close.
Yeah.
I wanted to spit out, but it wasn't from fear.
Yeah. It's just not liking it, which is fine.
Yeah.
You can build
And
up that.
it wasn't a half-hour battle to get it to my mouth even. It was just
Yeah.
a deep breath and go,
Yeah.
which I've never been able to do.
Yeah. But now you do. So I'm just asking, what do you think was the difference between today's session, the ones you had with Bob? How come your system went it today, do you think?
I think, to be honest, it's when I seen Bob, I'd asked for help so many times. I'd never got any answers. I was kind of at that stage of, yeah, whatever, nothing's ever going to help.
Right.
But if that was a couple of years ago, and my health has suffered so much more. It's just like something snapped in me recently and went, this has to change because this can't continue.
Right.
And it was like the defeated bit in me just went, right, it's got to fight now or just go. I'm done.
Right. Yeah. Yeah, you reach a point of fed upness.
Yeah.
And I think what I do today, because I have a lot of knowledge in the field, I'm able to explain things away where your system says, you know what, that makes sense. I know I'm doing it. I know what I need to do to stop doing it. And I choose it, so I've done it. So I think that's the difference. You know, you can sort of, the information is power. And I think it kind of says, this makes more sense, it's clearer. So now I know what to do. So I've taped this last bit, by the way, just to show Natalie. So, you know, thank you for this. I don't know if you're going to call Natalie or email her or, you know, and just let me know. And then, you know, if you have any questions, let me know. I will send you, I think I'll send you already, on email, a post-therapy tips. Put this